Hi, this is Jennifer Kirschenbaum, coming to you today, April 29th, Wednesday. We're about 6 weeks into our coronavirus COVID-19 pause in New York, and I want to address some questions that have been posed by everybody, and that's why we're having today's webinar, to kind of go through some basics and give you some feedback on what I'm seeing across the board, and hopefully help everyone prepare to reopen, which we're hoping is going to be sometime soon. So the agenda that I've established based on the questions that have come in are going through elective procedures. What are they and when can I reopen? We're going to go through the Medicare Grant, which I think there's a lot of questions going on about that. I'm going to try to be quick. On each of these, we'll try to be quick. Then we'll go through a PPP Lightning Round and preparing for reopening our employees and patients, some of the frequently asked questions that I'm getting from people across the board that I think is important for you to have information on. So to get started, elective procedures, this is a question that came in. What's going to be allowed to be performed in New York City after May 18th if the restrictions are going to be eased? What will the restrictions be? The answer that I have is I'm sitting where you are. I don't know what specifics we're going to be given except what's available. So Governor Cuomo, specifically on elective surgeries, has acknowledged that he's going to loosen the grip before May 15th, the expiration date on his current pause extension. And it looks like upstate and other counties outside of the ones listed on the slide, Bronx, Queens, Rockland, Nassau, Westchester, King, Suffolk, New York, and Dutchess, are going to potentially be opening prior to that date if the hospital capacity is over 25% for the county, if they have been fewer than 10 new hospitalizations of COVID-19 patients in the county over the past 10 days. So these are part of the protocols that he's going to be looking at, and he wants to make sure there's plenty of capacity at each hospital before he's going to open up and allow elective surgeries to come in. Now, for other specialties, you have to ask the specific experts and colleagues in your field, and we're going to get to what that's going to look like because there's been some doctor shaming already. We all have one priority that we may or may not be aware of, but those of us who are aware, it is to stay out of the press. And we've seen the New York Times do this several times during the COVID-19 lockdown period. They have publicly called out and shamed a couple of doctors for being open. Of course, we are allowed to be open for emergency services. We absolutely are essential, those of us that are on this call, and it's really within somewhat your discretion on what is emergency versus elective, except we're going to go through some specifics that certain specialties have dictated, and I'm going to encourage everyone on the line to check with your specialty associations and societies statewide and nationally to see if there's anything you're not aware of, and also speak to colleagues in your field to see. So these are just a couple of headlines that I pulled for you to see. And I've received a couple of questions from a few dermatologists of, look, how do I not get on the front page if I have a patient who comes in for a medical reason, for a melanoma, or I'm excising something that has to come out? If that patient, while they're there, asks me for Botox, how do I not get plastered on page 6 of the post? And the answer to that is going to be a mix. You're at the end of the day going to be left to do what you feel is appropriate in your own professional medical judgment, and also what's kind of acceptable in the times. And if you have a medical reason why a patient is in your office, it's going to be at your discretion whether or not you want to do any additional services. How would that information get out? I mean, that is protected health information. It's HIPAA information. If the patient, him or herself, were to broadcast it to the community that they have those services done at your location, that could cause a problem for you. So perhaps you want to talk about discretion. Same thing with your employees. If that information were to be getting out, that would be a real violation of their confidentiality obligations to the practice. So perhaps as we onboard everyone again, we're going to want to remind them of what their obligations are to the practice, and possibly have some of that verbiage available to be signed off on as people come back on board. So this is straight from the American Academy of Dermatology. They are specifying that each individual dermatologist is going to have to make their own protocols for what constitutes urgent and/or essential dermatological services during COVID-19. But they are giving a little bit of guidance and also encouraging individuals to utilize telehealth during this time. So I think with a lot of specialties, it's going to kind of come down to what are our colleagues doing and what do we all as a consensus believe is going to be appropriate. So I would dust off our Rolodex and start calling some of the people we went to school with and see if we can get also our associations that many of us do pay dues to get a little bit more involved and possibly putting out some more public material on what will and will not be acceptable. Maybe some more FAQs from our national associations would be really, really helpful, really to protect our practitioners as we start entering into this new COVID world. Dentistry, this is very specific for dentistry. They said this is routine and non-urgent services. They gave a specific list. There's also a long list of what is considered to be urgent emergency services for dental. So you want to be careful. I know a lot of us, there may be a hygienist on the phone, I don't know, but we want to be careful about what we're going to be bringing in as the restrictions do loosen and we come back into our new normal. CMS is offering very general guidance, and if anyone wants any of these links that I'm going too fast, you can email me after, and I'm happy to send them over to you. But CMS is offering general guidance, and they talk about basically a triage system and what qualifies as emergency versus non-emergent. And if you have some extra time and you want to look at their specific chart, that might be helpful. But it's really going to come down to what you feel you can justify is an emergency in your medical notation as you start to open. Many of you on this call, because I know who's on the call, I know are planning to start adding days now before this May 18th date comes upon us. And just be careful that everyone you see, there should be documentation prior to the official lift. You're certainly authorized to open, as I said, but it should be now for the main purpose of the visit, a medically emergent or time-pressing reason, and that's why the patients are being scheduled at this time. We do have, hopefully those of you who are starting to schedule patients for that week of May 18th, I'm hoping that they're not going to have to be pushed off. We're going to see what's going to happen in the state. I don't have any more guidance on that than you do. So recommendations for avoiding having your name in the press: messaging to employees, and we may want to reiterate confidentiality and HIPAA concerns for patients as they come back on board, and then collaboration with colleagues on rollout. And I think that that's very, very important. For those of you that know that I'm affiliated with some of your associations, we can talk about that more after and see if we can try to pressure on the national level to get some more details going. But some of the specialty associations have been really very good about constantly updating, and hopefully they'll roll out in the next week or two some further guidance. The Medicare Grant, and I think there's been confusion on this because it's of course overlapped with the PPP. So one of the basic questions I received in advance of today was, for the Medicare Grant money we received, not the PPP, still waiting on that, as is many other people, what should we be using those funds for? As I understand that we should not use it for anything that PPP would cover, like payroll. So I'm going to go through some more questions and we'll go through the basic information. I know also for the Medicare Grant, those of you who received the money, you received it a week or so ago, and then you know that there's an additional $20 billion available, and you saw an April 24th date. You didn't miss the boat yet for that. So what I'm talking about is not the Paycheck Protection Program, which we'll touch on a little bit later, but the Medicare Grant, that those of you who accept Medicare had money just miraculously in your bank account a week or two ago. That was part of this $50 billion of provider relief that was under the CARES Act, and there was a $30 billion bucket that was distributed between April 10th and April 17th to practices, individual tax ID numbers that accept Medicare. There was then a second tranche that became available of another $20 billion that's being distributed beginning on Friday of April 24th. Now, the $20 billion you have to justify receipt for, and we'll get to what that looks like in a second, but approved uses of the money that you may have already received and money you might get for the $20 billion are payments that are used to prevent, prepare for, and respond to coronavirus. And payment shall reimburse the recipient only for healthcare-related expenses or lost revenue that are attributable to coronavirus. You are not allowed to use the payment to reimburse expenses or losses that have been reimbursed from other sources, like the PPP, and you are allowed to use it for compensation, but there's a cap of $189,000. So what does this mean to me? Well, it means to me that there are a lot of strings attached to this grant, and these aren't the only strings that are attached. There's a laundry list on the terms and conditions, restrictions on what you can use it for, some basic federal restrictions that they put on everything. You can't use it for lobbying, for instance. Your real purpose of this money is to supplant damage that's been done to your practice as a result of COVID-19 and the shutdown, and also to cover for care you may be giving to individuals that have COVID-19 because they're not allowing you to take co-pays in many instances, or payment for the uninsured. So that's where this money is coming from, and you can use it to supplement lost income for yourself, and it's going to have a cap of $189,000. Now, if you want to pay for the 2-month period that you're at with the PPP, your first $8,333 per month, right, for the annualized cap of $100,000, you can use the PPP money for that, and you want to earmark and show that that came from a specific bank account. You then can supplement, if you document it properly, the additional monies for the secondary cap that's offered here with the grant, if that's how you want to be using your funds. Now, the purpose for today was really more of a working call. I kind of felt like everyone had to have the same consult, which is why I thought I would do it in a webinar format and just get through everybody at one time here. With these funds that you're getting, they should be, whether it's under the Medicare Grant or another stimulus initiative or the PPP funds, when you get the money in, they should be in a separate segregated account. And we need to be really very, very careful on how we are tracking the money expenditures. So that's the first thing that I can tell you about that. I'm not going to get into any tax implications on the grant money use or the PPP. That would be a separate conversation, and one that I would expect all of us to be having at this time with our accountants and other advisors. And you really want to track and be very careful about how this money is being expended. For the Medicare Grant, whether it's under the initial bucket that you got the dump before the 17th or the second tranche, you must certify with Medicare within 30 days of receipt for the first tranche, and then you're going to certify again for the second, that you're going to adhere to the terms and conditions. If you don't fill this out, you are going to be subject to potential recoupment of the money that you receive from the grant. So please use the link, please certify. You're required to keep records of compliance. Okay, for the new grant that's available, the $20 billion, you have to apply for it if you do not have enough information in the Medicare system. Some of our colleagues are not going to, they're just going to automatically receive a portion of the 20. But for some of us who have not, Medicare does not have this information related to gross receipts or sales, estimated revenue losses, a copy of your recently filed tax return, which most of us, they wouldn't have this stuff, a listing of any additional tax ID numbers that might be affiliated with you. This information is mandatory before you receive any piece of the secondary bucket of the $20 billion. Now, a requirement to receive part of the second tranche is that you received part of the first. So every qualified provider should have received a piece, and it's by tax ID, not by provider ID number. So it's going to be under your tax ID number, you would have received it. So if I have individual physicians with a Medicare provider ID number that did not receive money, you would not have. It's only going to be under the TIN for the entity that you're rendering services for. And if you receive that money, then you're going to be eligible to be under the second umbrella of the additional $20 billion. You're going to have to go on to the, let me see where I have it. Okay, you're going to have to go on to the portal. Okay, that's great. That's not good. Okay, we are going to have to redo this recording for you later to post it, since that just went up. Okay, we're going to certify for the grant, and from there, we're going to hopefully qualify for the second tranche. Okay, moving on for the PPP Lightning Round, because I don't want to spend a lot of time on this. If you want to see the most up-to-date guidance from the Treasury Department, you can search on Google for Paycheck Protection FAQ April 28, and it's going to come up. And you'll see multiple pages of just frequently asked questions on the PPP. Some of it will be helpful, some of it will be for lenders, and you're not going to care about it. You're still waiting, I understand. That's where a lot of people are. They're in line with SBA, and they do not have an SBA number. If you were freaking out, you should be, because the money's going to be out very, very soon. So I do not have any leads in for a better way to apply. If you're hearing nonsense from your bank or what you think is nonsense and they're not giving you an actual SBA number, keep calling. Have one of your assistants that is still on with the practice call every 2 hours if you want. But the next couple of days, that's going to be it. The money will be out. So I would pressure wherever your applications are in. If you have received it, congratulations. If you receive the money, you have 8 weeks from receipt to spend it. That's one of the questions that I receive every single day. You have 8 weeks from when the money hits your bank account to spend it. When do you have to rehire your staff by to qualify for forgiveness? The date that I'm going to commit to, because we haven't received any guidance yet otherwise, is going to be the June 30th date of this year. So you have until June 30th to rehire your current or prior staff prior to COVID in order to qualify for forgiveness for as much as possible. Now, this is, I think, the biggest area that we should talk about, because it's where we can do the most work in preparation. And I think that a lot of people are having just a real problem with how they even start going about putting the practice together. And that's what I've been seeing this week. So we're going to talk about staffing for a minute. Some of our employees are pushing back on returning to work, and I've heard all of these reasons multiple times over the last couple of weeks. The employees are receiving too much money on unemployment. They're scared. They're high risk. Their mother they live with is high risk. What do I do? They will not come back. Okay. A job is something that we are paying people for a specific duty, role, or function. And most of our employees are at will. If they are refusing gainful employment that is available, they are not entitled to unemployment insurance anymore, okay? And you do not, there's two things. They do not have to come back. You can fire them if they refuse to come in. You can and secondly, you can notify unemployment that they are refusing to come back to work. And obviously, that's a very punitive step to take, but I have a number of clients that are already there that have done everything that they can. They have large practices, and individuals are absolutely not willing to come back to work. Well, if you have that situation, or even one person that you know is just sucking from the system, then absolutely 100% unemployment in New York State and other states, if you're listening from other locations, they want to hear from you, from the employer. The whole purpose of the PPP, if you did receive it, is so that your employees will be back on your payroll and off of the government's dime. They want your employees lined up to continue to go back to work. So you would be sending a notice to the unemployment department that the claimant refused to come back, the type of employment offered, the wages offered, the amount, if it's less than what the claimant earned on the last job, which is, hopefully they're going to be restored at the same salary, I would imagine. And what I would also recommend to do is that if the claimant is refusing to come back to work, the best thing that you could do if you have the capacity is to document that you sent the notice of employment to the person, either by email or in writing, and you're going to have to notify the employee also in some sort of writing, whether it's email or through the mail, proof that you sent it, and you're going to send that into the unemployment department as well. Okay, so employee pressure is a big thing that I'm hearing too, and this is actually came in, the individual might be on here, I'm not sure, who sent this in to me, but this is an employee who sent me an email, and she said, my boss has no plan for employees or patients when she reopens. She feels that if she schedules one patient per hour, that is all is needed. I'm worried about myself. I'm worried about when we're going to clean, how are we going to clean, what are we going to do with materials in the office. Well, what I would say is that this is a little bit of a premature question because this person is not back in yet, so perhaps these materials would not be disseminated yet to the staff in advance. However, the employee is not entirely wrong. These policies and procedures protocols have to be worked out before the practice opens. And we need to have a plan on what we're going to require of our staff. What are the new job descriptions? Is there going to be someone opening the door for patients? Who's going to be doing the pre-screening? What's the pre-screening going to look like? What are we going to do with the waiting room? Are we putting the magazines away? How often are we wiping down the tables and chairs? Are we removing some of the chairs from the waiting room? Are we having patients wait outside? How often are we cleaning the bathroom? Are we monitoring the bathroom? I've read materials saying discourage patients from using the bathroom. I don't know how you do that properly and cordially. And what is everyone going to be signing as they come back online? Because you want to make sure you have some understanding from the staff and also the patient, some sort of informed consent from the patient, some sort of staff protocol from the employees. And so I think, these questions are telling. All of us know that they're going to be thinking about this as they come back, our employees, and they're looking to us for guidance. These are more stressor questions that I received. Legal pitfalls with employees contracting coronavirus after reopening. Can patients sue my practice if they contracted COVID-19? And this is another one, same thing that we'll talk about. In the event an employee of mine tests COVID positive and subsequently infects her husband and they both die, is there insurance I need to buy? So let's talk about insurance and let's talk about infection with COVID-19. I think we're all aware that we are, as a society, not currently doing contact tracing, that especially in our hot zone of New York, it's assumed that most of us have been exposed to this thing in the city. And for those who are in the boroughs, perhaps you've been spared. As the testing rolls out, we're going to know more even by next week and the week after for sure, because the testing seems to be much more prolific even this week. And we're going to have a better idea of where we are regarding, I don't think we're anywhere close to herd immunity from the percentages that I've heard, but we're going to hear what it looks like. But right now, it would be impossible, really, to definitively trace back to your practice. Let's say we're a few weeks out and we get this thing under control. I think we still have to be prepared to operate in an environment where you may have an asymptomatic employee who comes in. You may be that asymptomatic person, and there could possibly be some sort of potential outbreak in your office. That being said, we are getting back online, and many of us are ready to go and are opening in accordance with acceptable guidelines. So what does that mean? What does it mean to be in a post-COVID world? Well, you're going to adhere to policies that you set. And I would encourage all of our employers to adopt policies they can actually adhere to. So I've seen pushback. I've pushed back on requirements to close for 3 days for deep clean. Many of you are adhering to the highest levels of sterilization and disinfectants, using disinfectants that are approved for this type of disease. We've culled through all the materials at CDC and the other government run recommendations for disinfectant levels and types, and it seems that that we can absolutely adopt best practices where we are regularly sterilizing and employees are going to be treated. If they have to rotate out because they're sick, they will. And we're going to talk about what that looks like in a second. Before I get past that, I want to talk about insurance. So you have workers' comp, you have malpractice insurance, you have general liability insurance. You're the practice owner and someone gets sick. What's the claim against the practice? Well, malpractice insurance is not really going to cover it because this is a pathogen that they would have encountered just physically being in the office. I am not sure if general liability insurance is actually going to cover for this one, and so I'm going to double check with a broker. Another policy that I would consider looking into is errors and omissions. If you have it, great. If not, I would look into it. And directors and officers insurance. Now, I'm not sure if either of those policies will have
disclaimers on them, and if they would actually apply. But what those policies are for is for protecting owners from decision making that they make for their actual practice. So if you as an owner are going to make the decision that these protocols are enough, and you followed best practices under CDC guidelines, your professional association, OSHA, everything that's available, which we'll go through in a second, then that's what the purpose of this insurance policy is for. So I would want to speak with my broker and just make sure that as long as I'm following best practices, if we are at the point where we can do contact tracing, and contact tracing leads itself right back to my medical practice, I want to make sure that if I can prove I followed everything, I put protocols in place, that if there's still a claim, it would be covered under this insurance. Right now, I think that claim would not exist, but 3 months from now, it might. What's going on with business interruption insurance? I believe that I do have a question asker on the line that was very, very concerned about business interruption insurance. And what I would say is that there has been a number of lawsuits that have been filed. They are differentiated very clearly in my mind, because there are different types of business interruption insurance policies out there, and people have different disclaimers in their business interruption policies. So I can't have a specific conversation with anyone about what your coverage may be without actually seeing your policy. And I recommend that everyone call their brokers if they have not already. Most of you have. And I would insist, regardless of what my policy says, that a claim be filed, because you want to preserve your right to potentially challenge a denial at a later point in time. So I would recommend calling and pushing for a claim be filed just to preserve that right. What can a COVID-19 infected employee return to work? Well, this is from the CDC guideline for medical practices specifically on when a healthcare employed person, doesn't have to be a healthcare employee, it can be just an admin person who works for a practice. When can they return to work if they're sick with COVID-19? And this is going to be around, unfortunately, it seems, for a while. If there's a test-based resolution of fever without use of fever-reducing medications, improvement in respiratory symptoms, negative results of an FDA emergency use authorized test, they want a total of 2 negative specimens, then the person is authorized to come back to work. If there's no testing available, or if the employee just can't get tested for whatever reason, then a non-test-based resolution is at least 3 days have passed since recovery, defined as resolution of fever without use of fever-reducing medications and improvement in respiratory symptoms. And also at least 7 days have passed since symptoms first appeared. Now, I know many of you actually have had COVID-19. I've spoken with you about it. And you've also expressed to me that you're not very comfortable, based on your own symptoms, to follow these guidelines. You want to add a couple of extra days to that 3 days have passed since recovery. You are completely, absolutely authorized to do so. That is, it's your practice, it's your policy, it's however you want to treat your staff, that's fine. At a bare minimum, I would say that it would be ill-advised for any physician to allow any less than the CDC minimum. So let's look at the CDC guideline as an absolute base minimum, and we're going to at least adhere to this protocol, if not more, and we'll go from there. So that's my recommendation there. These are guidelines and resources that I would recommend viewing if you're interested in kind of learning up on practice protocol and resources, or have your office manager make sure to go through them. And I'll put these on the newsletter when I re-record this and send this out. And this way you can click on it directly. But the CDC website has a lot of information, in particular for healthcare providers and practices for when they're going to open. ASCs, and I guess just by association, it's not specific for OBS, but ASCs definitely have more requirements. What I was interested in looking at is procedures that potentially have an aerosol impact. We don't have any real guidelines on that yet, but basically what the CDC has said is that we know that it's very aerosol generating procedures are a lot more dangerous, and the provider should up their PPE game but there's no real parameters that I saw. So if anyone has anything out there that they want to send my way, I would love to see that, because I think it's very important to incorporate into a number of specialties policies. So would appreciate that. OSHA has very, very generic materials that are available to just talk about workplace barriers and some other things that you might want to consider. Okay, we finished our policies. I told you we were working on them. If you want us to send them to you, I put a cost of $250 on them. I think that everyone needs an informed consent from patients. You don't have to get it from me. You can feel free to make your own or find from another way. But patients need to come in and certify that they understand there's risks of being at the practice. I think that the protocols that I would put into place are going to be basically directives for the staff. What are you expecting from them? And then I also want a staff acknowledgement form that they understand they're coming back into this post-COVID world. They're going to adhere to the new responsibilities, including disinfecting and all the rigmarole. And they're going to, of course, immediately notify you if they have any symptoms or believe that they might be, for some reason, they have a reason to believe that they may potentially be contagious because of themselves being exposed to someone else. I also, when developing, realized that there's a lot of information out there on by CDC, New York State, OSHA, CMS, the professional societies, that's very helpful for the employer to be knowledgeable about, but that really shouldn't be given, because I don't like to empower more than they need to be employees. The practice ownership should have options and understanding. And so we've put together a separate document for practice ownership instructions, and we're giving this all out as a packet if anyone is interested in that from us. Okay, so the guideline and resources, again, I'll send this out in the newsletter for you to click on them. Advice on employee onboarding as you bring them back. The practice policy should be available. So back to that employee's question of, look, no one's given us anything. I don't know how we're going to be safe. Are we handing out pens? What are we doing about social distancing? I've gotten no direction from the leader, from the boss. I hear that, and I understand it. And so I think that all of us that have been racked with anxiety on how we're going to pay these people and how we're going to have money to open back up, the first step is we need written policies and procedures so we have a place to start. And so that way they can see leadership from the practice owner. And this is how we're going to protect the practice. This is how we're going to protect our staff and our patients. And that's the first thing I think that I see is needed, one of the first things. Maybe that's because I'm the lawyer who does the paperwork, but that's one of the things I see. Revisit and redeploy job descriptions. I think you have to reconfigure now what role is everyone going to play, especially people in the front. You're going to have to be very, very specific on what their obligations are. So I would divvy it up. If one person's going to be responsible for patients coming in and patients leaving, if someone's responsible for cleaning, the front tables, someone's responsible for the bathroom, wiping down the front desk, basic disinfecting. I would start doing that. And then who's responsible for the informed consent with the patient? Who's going to be doing the pre-screening tracks? All these things need to be worked out before you start bringing everybody back in. You're going to document and rehiring and reinstating. So we're going to have the staff sign off on materials, so that way we're really clear on what they're coming on board for, and also that they're signing off on being in the office with this post-COVID world, and that they're going to follow the protections. Supplement contracts as needed. So some of us may have had employees that we terminated or quote-unquote furloughed, and we possibly maybe owed them money during this period, or we have to decide if they're starting fresh or if we are picking up where we left off. And if so, do we need anything in writing to document this gap period? And if we do, we should be working through that now before they come back on board. And that's why we're revising where needed to adjust for the new normal. A lot of my clients are looking to go from a flat salary now to more of a production-based. So that's something to think about, incentive compensation structures if you can. And then also, I know that there is concern that we may have disruption again in the fall, or I spoke with one of my clients who's a pulmonologist earlier. He said really he's concerned more so about the winter than the fall. So what do we do about our employees that we've had such problems figuring out how to deal with pay structure now? Do we want to address it, that there might be another period of time where the practice owner is going to, again, have to have some downtime. And what I would say there is that myself, and I know all of my colleagues, are now going to be putting language into the termination provisions that basically are going to give employers a pass for this kind of timeout and allow at least termination of a contract, even with an employee who has notice for this type of government shutdown, because most of our contracts don't have that in it. So I think it's something to think about, and you want to see what we need to revise before they come back. So I think we do have some questions that came in while I was on. Okay, let's see. Okay, I cannot give a webinar every day of the week because I can't figure out how to use my electronic stuff, and my GoToWebinar keeps failing. Okay, so you guys are giving me a break. I don't have that many questions, which is great because I'm tired. Oh wait, I can't now. I couldn't see them, so now I do have more. Sorry. Okay, let's see what we have here. Now I have to re-record this because that thing popped up in the middle. Okay, what if my practice is new and my 2018 income from month to month is 0? Income has been increasing. How can I get relief commensurate to the current loss of the income? So to this practice owner, we are talking about today, commensurate to income, only the Medicare grant. So you will be putting in all information needed, but they also have your history for 2019 and beginning of 2020. So my recommendation is just apply and let's see what you get, and hopefully you'll get under the PPP, because that's also not based on income. That's based on how many people you have, employees. It's based off of your payroll. Okay, can a short-term disability carrier say that a claim is workers' comp for an employee who was exposed to a COVID? Yes, I absolutely think that that might be the case. Look, it's a blame game. I mean, I know everyone's watching news and everything else. Everything's a blame game. So, and pushing responsibility. So, if you have an employee who gets sick on the job with COVID-19, are they going to try to dump it on workers' comp? Probably, and workers' comp might try to dump it on disability. One way or the other, one of those is going to pay for it. So, I'm not super perturbed about that one, but that's true. It might. PPP funds need to be used within 8 weeks of you receiving them, and the date starts the minute you get the money. Okay, so with a Medicare grant, how can you calculate the amount of salary for owners allowed given the 197 max? Is it prorated over the rest of the year? Yes, the 197 is going to be an annual amount. So, and remember, I don't know if I was clear on my math. I went through it a little flustered, but under the PPP, you're allowed to pay an annualized salary of up to $100,000. So now with the Medicare grant, you have another $97,000 annualized. So that's going to be, I don't want to do the math, but it's going to be a little bit, obviously another tranche that you can pay. The most important thing is going to be how carefully you earmark these funds and you follow. Okay. I offer cosmetic and medical procedures. Assuming I'm able to reopen on May 15th, can I resume all services or only the medical? If once we are lifted, I am happy to say you will be able to go back to work for everything. So you will not be restricted if once it's lifted. So you can do the cosmetic also. I also, look, my job is to protect the employer. So I don't want anyone fined. I don't want anyone on the 5 o'clock news. But if you have a patient who's coming in for a medical legitimate purpose and there's a cosmetic component, and you don't feel that it would be safe for the person to come back in the middle of May to just for the cosmetic purpose, I mean, I'm going to tell you to treat the patient and to do the cosmetic portion. And I'm going to record this, and I'll make the same comment later when I re-record this, and it'll be out there. And let de Blasio come get me. But I think that if you can justify the medical visit, you have a little bit more freedom. Now, this is not carte blanche for, I'm not saying that people should be doing anything fraudulent. You can't be documenting medical necessity that's not there. But if someone is coming in for a true medical emergency purpose and there is some cosmetic component, I don't see how the doctor doesn't treat, and that's just the reality. With respect to the Medicare grant, I received a small direct deposit labeled on April 10th, and then the second deposit. Are these both part of the Medicare? Okay, the advance is not part. So you have two different lumps that you got, it sounds like. One of them is part of the advance, which it sounds like you asked to participate in that. And I am sorry, I can't follow everything. I'm trying, but I received information that I'm not sure is confirmed, and I will check and send out on it for the newsletter, that the Medicare Advance program was possibly being paused itself. If you receive some money there, that's going to have to be repaid. So that's very different. The grant you get to keep as long as you use it for COVID-related purposes, which is not super specific. The government hasn't given us a lot of direction there, but you can apply it towards co-payments and lost revenues, and also it sounds like to salary under this 197 level. Okay, let's see if there's anything else here. I think we're good. So I'm going to end this for everyone. If you have more questions, you know how to reach me. If you need help with the policies, let me know. We, of course, are not charging anyone near the time it took us to compile them. So we're here to help. And if there are questions that come in, I will be happy to do another webinar next week. And hopefully, finally, I can have one where my computer doesn't give me problems. And anything else in between, just send me an email. I hope everyone has a wonderful day. I want to thank all of you for all the work that you do. And we're happy to be here to help during this time period. Hope everyone's feeling well. Okay, have a great day.